Alright, well, after a short break, we're back to part 2 of Chapter 12, and we left off with drugs affecting the cardiovascular system, so that's where we'll pick up. And some general information about drugs that affect the cardiovascular system starts first with our antiarrhythmics. They're drugs that are used to help treat or prevent cardiac rhythm disorders, particularly rhythms that are extremely fast or rhythms that are irregular, or rhythms typically that are really fast or really irregular. Some other antiarrhythmics include adenosine. Adenosine is a drug that works in the AV node of the heart's electrical conduction system. It has a really short half-life and a rapid onset. It's got a 15-second half-life. So when this drug is administered, it has to be pushed really fast, followed with lots of fluid, to get the drug up into the central circulation where it can do what it's supposed to do. By slowing conduction through the AV node, it does slow and terminate certain supraventricular tachycardias. They spelled that incorrectly on the slide. It's supraventricular tachycardias, and those would be rapid heart rates above the ventricles, as we'll learn. So adenosine is a common drug that as a paramedic you would push for really rapid heart rates that were symptomatic. Digitalis is a cardiac glycoside, and digitalis comes from the purple foxglove plant. And what it does is it increases calcium concentration in the myocardial cell, and by increasing the calcium concentration within the cell, it increases the contraction of the cell. An overall effect is that it slows conduction or controls rates in patients who have atrial fibrillation. Antihypertensives include medications that lower blood pressure, and by lowering blood pressure you're going to reduce the work of the heart. Now, with antihypertensives as well, oftentimes, because there are such a wide variety of them, you've got to find the right one that works well for you. One of the obvious side effects of an antihypertensive would be a blood pressure that ends up being too low. And by being able to find the antihypertensive that works for you, you're able to be on that for long term to help manage your hypertension. Some antihypertensives include diuretics, and these work in lowering the blood pressure by decreasing intravascular volume. And these would include your loop diuretics that work in the loop of Henle in the kidney, and these happen to be non-potassium sparing, so they make you, when you take them, create large amounts of urine in a short period of time, and in creating all that urine, you not only get rid of water, but you also get rid of sodium and potassium, and so you have an excess potassium loss and an excess sodium loss when you're on these loop diuretics, and they include Lasix and Bumex. Some other diuretics that help lower the blood pressure without causing a potassium loss include thiazide diuretics, and the most common thiazide diuretic is hydrochlorothiazide, or HCTZ. So you'll see people on that. Potassium sparing diuretics include spironolactone, and spironolactone increases sodium, and water follows sodium, so it does help retain potassium. If you retain sodium, you also retain potassium as well. So those two kind of follow each other. Osmotic diuretics, they pull fluid into the vascular space, and they help increase osmotic pressure. A common osmotic diuretic is mannitol, And mannitol will be given in patients with closed head injuries and their blood pressure is really high. They'll use mannitol to help lower the blood pressure in that situation. It's not used a lot pre-hospital. Some services carry it, some don't. It really depends on the referring neurology group and whether they're a fan of using mannitol. There are some other drugs out there that help lower blood pressure, adrenergic blocking medications. Because they're adrenergic blocking, they block the effects of what happens when you stimulate the adrenergic nervous system or the sympathetic nervous system. And they include beta blockers. Beta blockers occupy the beta receptors, beta 2 in beta 1 in particularly in the heart, which decrease the rate of contraction, decrease the strength of contraction, and the overall outcome of that is a decrease in cardiac output and a lowering of blood pressure. Beta blockers also inhibit the renin secretion from the kidneys, and renin, when secreted from the kidneys, combines with angiotensin and forms angiotensin 2 in the lungs, which causes your vessels to constrict, and by constricting of your vessels, the pressure is raised in the system. Well, if you inhibit renin release, then you don't have as much of angiotensin 2 and you don't have as much of vasoconstriction. So your vessels relax a little, your pressure drops. Beta blockers are drugs that end in LOL, metoprolol, any drug that ends in LOL is that's going to be a beta blocker. Peripheral adrenergic inhibitors include medications that help dilate vessels out here in the periphery, and most of those, as you see, are medications not sold, through a pharmacy, but more through a GNC or a health store, where they are derived from tropical trees and shrubs, and they include things like African snakeroot and mistletoe and Jamaican dogwood and hawthorn and motherwort, really names of herbs that may have an effect in dilating vessels out here in the periphery. And any time you make your blood vessels larger, you're going to drop the pressure in the system. Angiotensin converting enzymes, or ACE inhibitors. ACE inhibitors, they affect the renin-angiotensin-aldosterone system as well. I had mentioned that renin, when released, combines with angiotensin, and the angiotensin converting enzyme converts angiotensin 1 to angiotensin 2 in the lungs. And if you take an ACE inhibitor, you inhibit the production of this angiotensin converting enzyme, and so angiotensin 1 does not become angiotensin 2, and the vessels don't constrict. They kind of dilate. You'll see patients who have hypertension prior to their heart attacks, and certainly after their heart attacks, if they're hypertensive, being placed on ACE inhibitors. The most common ACE inhibitor out there is lisinopril. You see that a lot. But captopril, enalapril, those are earlier ACE inhibitors. The issue with ACE inhibitors, too, is that when people take these ACE inhibitors, because the reaction occurs in the lungs, they may get a little sort of inflammatory response as a result of taking their ACE inhibitor in the lungs, and they develop a really productive smoker's cough that some people find very irritating. So in that particular situation, looking at an ARB might be a better fit for them. ARBs are angiotensin renin blockers, and an ARB works a little further down the chain. and it works in the liver, not in the lungs. The result is the same. The vessels dilate, and as a result of the vessels dilating, the blood pressure drops. And the most common ARB out there right now is Diovan. So these are medications that certainly can be taken, and the benefit of these over beta blockers is that if you've got a diabetic, if you've got somebody who has poor kidney function, by dilating the vessels, you not only drop the blood pressure, which is easier on the kidneys, but you also increase blood flow to the kidneys, which is better for them as well. Calcium channel blocking agents, they of course block calcium and prohibit vasoconstriction of vascular smooth muscle. And if you can prevent the constriction of muscles and keep those vessels, a little dilated, then the pressure will remain lower in the system. Calcium channel blockers include cardizem, verapamil, nifedipine, Norvasc, with certainly cardizem being the most prevalent one of those. Vasodilators can be taken to lower the blood pressure as well. Vasodilators work in the peripheral blood vessel walls, causing the walls to dilate and inhibits constriction out here in the periphery. Again, anytime you dilate vessels, you're going to decrease blood pressure. A common vasodilator used to lower blood pressure in an acute stage would be nitroglycerin, because nitroglycerin does relax smooth muscle, causing dilation of the blood vessels out here in the periphery, and it does drop the blood pressure. So nitroglycerin can be used to lower the blood pressure in acute settings, as well as an infusion of nitroglycerin or an infusion of sodium nitroprusside. So these are meds that you might encounter when trying to lower the blood pressure acutely. Other agents that may lower the blood pressure include your MAOIs, your monoamine oxidase inhibitors. There's a list of them there. And then some ganglionic blocking agents, and there's a list of those as well. They're not common. You certainly don't see a lot of people on these for specifically to drop their blood pressure. It's more of an afterthought. Anticoagulants, fibrinolytics, and blood components is what we're going to talk about next. And anticoagulants are used to prevent blood from coagulating. Anticoagulants actually change the viscosity of the blood, and they shouldn't be confused with antiplatelets. Antiplatelets don't change the viscosity of the blood. They don't thin your blood out. Antiplatelets prevent platelets from aggregating, prevent platelets from sticking together and forming the basis of a clot. Anticoagulants prevent clots from occurring because the blood is thinned out. Antiplatelets include medications like aspirin, dipyridamole, clopidogrel, or Plavix is another name for clopidogrel, Ticlid, Persigrel. These are all antiplatelets that are used to help to prevent platelets from sticking together. Glyco-2B and 3A inhibitors are antiplatelets as well, and they're going to prevent platelets from sticking together, and they include medications like Riapro, Aggrastat, Integralin, and you'll see these given in non-ST segment elevated myocardial infarctions, or NSTEMIs, and we'll talk more about these in our cardiac section. An anticoagulant that a person may be on, I don't have one listed there, but certainly warfarin or Coumadin is probably the most common anticoagulant. Heparins are anticoagulants as well. We will start patients will administer a heparin infusion and start them on a heparin drip, during their heart attacks. So you may come across that as a paramedic. Anticoagulant agents, they inhibit the portion of coagulation cascade and prevent clotting from occurring. They don't break down clots. They just prevent them from getting larger. and they prevent other clots from forming. We use the anticoagulants in MIs. We use them during atrial fibrillation to prevent clots from forming in the atrium that increase the risk of the patient having PEs and strokes as a result of clots in the atrium. We give them in patients who have valvular disease, and we give anticoagulants to patients who have clots in their lower legs called deep vein thrombosis, or DVTs. Anticoagulants actually increase your risk of hemorrhage if you're to suffer an injury, and makes it harder to control hemorrhage if a patient is on an anticoagulant. Anticoagulants include heparin, as I had mentioned, warfarin, which is Coumadin, and enoxaparin, which is Lovenox. Fibrinolytics dissolve clots, and they help reestablish blood flow through blocked blood vessels. But the problem with fibrinolytics is that when you give them, they dissolve all clots, not just the clot at the site that you're working on, but all clots throughout the body. And so giving a fibrinolytic, there is an increased risk of developing bleeding, particularly bleeding from the gums, bleeding from failed IV sites, bleeding from Foley catheter insertion sites, those sort of things. But of greater concern is about a 5 to a 7% risk of developing a bleed inside the head and dying when you give a fibrinolytic. Fibrinolytics include tissue plasminogen activators, or TPAs, and they include alteplase, retiplase, streptokinase, urokinase, and tenecteplase. Tenecteplase is the most common one that we see given for heart anymore, because it's a single bolus based on weight, not to exceed 50 milligrams. It can be given quickly. Alteplase, or TPA as it's more commonly called, alteplase, you give 15% of the bolus initially, and then you run the rest over an hour, and then you got to flush the tubing, and so it's more complicated to give, and neither one is really better than the other. So most people use tenecteplase just because of ease of how to administer it. Anti-hemophilic agents help provide that missing protein factor for the clotting cascade in patients who may be missing that factor. And they include medications like desmopressin, factor 7A, factor 7, and factor 9. Blood and blood components. We've already talked briefly about crystalloids. We administer crystalloids, saline, lactated ringers, D5W, in an attempt to replace volume. And it's appropriate, certainly, to replace volume if the volume loss is from vomiting, diarrhea, that sort of thing. But if volume loss is from blood, then ideally we should replace that with blood. We consider those type of components colloids. Colloids are large protein-containing molecule solutions that stay in the vascular space a long time. Saline and lactated ringers are going to stay in the vascular space longer than D5W is because of their tonicity, but colloids have a tendency to stay there longer because of the large proteins. Colloids include things like whole blood, packed red cells, fresh frozen platelets, fresh frozen plasma, or even platelets. Anti-hyperlipidemic drugs are used to reduce cholesterol levels, and the belief is that if you have high cholesterol, that certainly is a cause of coronary artery disease, but it's not really understood if all patients with high cholesterols need to be on a statin or a medication to treat hyperlipidemia or high lipid levels in the blood. There's no debate that there's no debating the fact that if you have cardiovascular disease and your cholesterol is high, that you should take a statin. The concern comes from all the patients that have no cardiovascular disease, but their cholesterol is elevated, so they're placed on a statin. That's what's being debated. Lipitor is the most prescribed medication in all of pharmaceutical history. There has been no drug prescribed more in pharmaceutical history than Lipitor. So you got to ask yourself, does everybody need Lipitor? All those patients with high cholesterol, do they really need Lipitor? Because statins aren't without risk. Statins can break down muscle, cause a little bit of myoglobin release into the bloodstream, which is hard on the kidneys. Some statins work in the liver, some work in the stomach, and they're not without risk. So I guess if you know you have cardiovascular disease, and your blood cholesterol is high, you probably should be on a statin. But if you don't have cardiovascular disease, particularly if you don't have any other risk factors for cardiovascular disease, and your cholesterol is elevated, I don't know that you need to be on a statin. Okay. Drugs affecting the respiratory system include decongestants, and decongestants shrink the swelling of the nasal mucosa. They include pseudoephedrine, phenylephrine, which is certainly a derivative of pseudoephedrine, Nasocort, Afrin, neosynephrine. All these medications shrink the swollen mucosa to allow you to breathe easier. Antihistamines block the effect of histamine. Antihistamines then help dry you up, but they also cause constipation. Antihistamines are known to cause drowsiness and be a mild sedative as well. The most common antihistamine that's out there is diphenhydramine, which is Benadryl. But there are others. There's Zyrtec, there's Claritin, there's Allegra, there's Dramamine for motion sickness, and those are all examples of antihistamines. Cough suppressants help suppress your cough. Cough suppressants cut the number of times that you cough and make that less. When you got that tickle in your throat and you're constantly wanting to cough, you're not necessarily bringing anything up, but you just have that tickle causing you to cough. Dextromethorphan is usually the active ingredient in a cough suppressant, so you want to look for dextromethorphan, and you'll know then that that's a cough suppressant. Other cough suppressants include camphor, eucalyptus oil, and menthol, which are common things that you find in cough drops. You look at cough drops, and depending upon the amount that they have in there, it certainly determines the strength. The average mentholatum cough drop, is going to be somewhere around 7 to 8 milligrams of menthol. But you get up to, some of the more intense, stronger mentholated cough drops, they're containing anywhere from 10 to 15 milligrams of menthol per cough drop. Mucinetic drugs help break down mucus, make it more watery so it can be easily coughed up. It includes Mucinex, is probably the most common mucinetic drug out there. Expectorants decrease the adhesiveness or the surface tension of respiratory secretions, making them easier to cough up, so they don't stick. They aren't as sticky as they normally would be. So expectorants help you cough that stuff up. And guaifenesin is the active ingredient. So if you're looking for an expectorant to help you cough stuff up because your mucus is real sticky and hard to cough up, the guaifenesin is the drug for that. Bronchodilators do that. They dilate your bronchioles so you can breathe easier. There are sympathomimetics, beta bronchodilators, dilators that stimulate your beta-2 receptors, which cause your bronchioles to dilate. Now, albuterol is the most common bronchodilator that we give in the field, and you'll give albuterol treatments. But Xopenex is another one, and Xopenex, they've taken the X factor is how they say it. They've taken this factor out of albuterol that increases the heart rate, because we like albuterol because it's relatively beta-2 selective. It doesn't stimulate beta-1 receptors as much, but patients who have albuterol certainly can develop tachyarrhythmias while doing their breathing treatments. Whereas Xopenex is truly a beta-2 specific bronchodilator. It doesn't affect beta-1 at all. You don't get those increases in heart rate when a person does Xopenex. Anticholinergics, they block acetylcholine, and acetylcholine doesn't necessarily constrict your bronchioles, but acetylcholine causes an increase of bronchial secretions. So anticholinergics in one way do dilate or do improve the lumen of your bronchioles by eliminating mucus that might be in there. And they include Atrovent and Spiriva. Now, one thing that we'll see given is called a duoneb, and a duoneb is Atrovent and albuterol together. And a duoneb, you got the Atrovent, which dries up the secretions and actually allows for better distribution and better delivery of the albuterol. So patients who aren't getting much relief with their Atrovent, you can do a treatment with both albuterol and Atrovent. Spiriva is a handheld inhaler that a person might take to keep their secretions dried up, allowing them to breathe easier. Other bronchodilators include the xanthine derivatives, and xanthines relax smooth muscle, but they also stimulate your central nervous system and your cardiac muscle, and they include theophylline. So patients who take theophylline, might be, their central nervous system might be stimulated as well as their heart rate might be up. Leukotriene antagonists, they stabilize cells responsible for the inflammation process. And an example of a leukotriene antagonist would be Singulair. Prophylactic asthmatic drugs include corticosteroids, medications that a person would take knowing that they do have asthma to prevent the swelling of the bronchioles and the inflammation of the bronchioles. They don't work very quickly, so there's something that has to be taken ahead of time, again, to prevent the bronchioles from constricting, and they include things like Flovent and Pulmicort. Drugs that affect the respiratory center in the brain include oxygen. There are drugs that will directly affect the medullary center of the brain, or stimulate the medullary center of the brain, and they include doxapram. And then there are reflex respiratory stimulants, and reflex respiratory stimulants are what you might give somebody to make them take a deep breath. Spirits of ammonia is an example of a reflex respiratory stimulant. If we've got patients who are unresponsive and breathing shallow, and we're trying to wake them up, one thing you can do if you have ammonia ampules is to break the ammonia ampule and wave it under their nose, and they get a couple whiffs of that ammonia, and that just wakes them right up. We also know that certainly there are drugs that depress the respiratory system, and they include your narcotics and your barbiturates, and we have antidotes for both of those. Drugs affecting the urinary system. Medications are metabolized and excreted through the kidneys. So certain medications are harder on the kidneys or affect the kidneys more than others. NSAIDs have a tendency to be hard on the kidneys. Contrast dye has a tendency to be hard on the kidneys, as well as aminoglycoside antibiotics can reduce renal problems. induce renal problems as well. Drugs affecting the GI tract, we're going to look at antacids, and of course antacids help you control the production of acid. They help you buffer the acid that you have in your stomach, the hydrochloric acid that you have in your stomach. And they include things like Tums and Rolaids and just plain old baking soda, sodium bicarbonate. Antiflatulents reduce the formation of gas in the GI tract. Excuse me. And they include things like Beano. Taking those, before you eat something that normally is flatulent would prevent gas from forming. Digestants help you digest the food that you may eat, and depending upon what what sort of problem you have concerning the digestion of certain foods, there's hundreds of different products out there that you can use to help your digestive tract perform more efficiently. One that comes to mind right away, of course, is if you're lactose intolerant, you can take Lactaid and then have lactose-containing products. Like you can take the Lactaid and then have that bowl ice cream, or take that Lactaid and have that glass of chocolate milk. So there's just a wide variety of different ones, and they just help you digest stuff better. Antiemetics help control nausea and vomiting, and the two most common ones out there are Phenergan and Zofran. And the Zofran, as EMS providers, that's probably one you'll be real familiar with, and your patients who have a difficult time controlling their nausea and vomiting. Just because somebody's nauseated and just because they threw up once isn't necessarily a reason to give them Zofran. But if they're having a hard time and they're got the dry heaves and are very uncomfortable with their nausea, then giving them Zofran would be helpful. Emetics, these are medications that make you vomit, and emetics were used quite frequently following a toxic ingestion, but the problem with this is that most people are waiting about 3 hours before they seek help after an overdose, and by waiting that long, the medication or whatever it is, the toxin that they ingested, is often no longer in the stomach. And because it's no longer in the stomach, giving them a drug like Ipecac, and I think that's spelled with an I, giving them a drug like Ipecac would make them vomit. And whenever you make somebody vomit, particularly if their level of consciousness is altered, you increase their risk of aspiration. And so the risk of aspiration is not worth the benefit of giving the emetic. So we rarely use them at all. Now, if the person overdoses on something and we're there within 15 minutes after the overdose, you want to be calling poison control and see if that's something that should be done. Cannabinoids. Cannabinoids are appetite stimulants, and are also are help to control pain. And there are at least 85 different cannabinoids isolated from cannabis. And cannabis, of course, certainly is marijuana, is a cannabis. And cannabinoids or cannabis oil is certainly something that's garnered lots of attention in the Midwest recently, as states have considered legalizing the cannabis oil for the treatment of certain types of seizure disorders. Cytoprotective agents, these are agents that protect the lining of the GI tract. When somebody has diseases like Crohn's disease or ulcerative colitis, peptic ulcer disease, these drugs help protect the lining of the stomach and the lining of the intestines, and they include sucrosulfate and misoprostol. H2 receptor antagonist. These block histamine release in the GI tract, and so it reduces gastric secretion. And H2 receptor antagonists are used to treat stress ulcers, used to treat gastric reflux disease, And one of the earlier H2 receptor antagonists was cimetidine, which is Tagamet, and then ranitidine, which is Zantac. Proton pump inhibitors, or PPIs, they came along second generation, and their main action is a pronounced and long-lasting reduction of gastric acid production. So proton pump inhibitors just do that. They inhibit the proton pumps in the stomach from secreting acid, and these proton pump inhibitors are used to treat GERD, as well as peptic ulcers and those sort of things. And Prilosec, Prevacid, Nexium, those are all examples of PPIs. Laxatives are used to increase excretion of stool, and they include Dulcolax, X-Lax, Miralax. Some are more harsh than others. X-Lax, because of its chocolatey form, certainly has been the part of many pranks, showing up in brownies and other desserts that require chocolate. Antidiarrheals, although diarrhea is an inconvenience, it's often the result of an infection, or it's the result of eating bad food, or it's a result of high bacteria counts, which can be damaging. So the fact that a person has diarrhea should be taken seriously. But antidiarrheals can be purchased over the counter. Certainly Pepto-Bismol, Kaopectate, Lamodal. These are all products that, when taken, help slow down the GI tract, particularly Lamodal, and help stop the diarrhea. Many of these products contain other products as well, like Pepto-Bismol just doesn't have only the medication to help with diarrhea, but may have acetaminophen, may have other products in it as well. The thing to remember, because diarrhea is a symptom of something that could be pretty serious, as an example, ulcerative colitis, if a person doesn't know they have colitis, and they start taking these over-the-counter antidiarrheals, it could lead to a serious medical problem. So, take into account when you're doing a patient history, if a person's taking a lot of these over-the-counter antidiarrheals, and they're not getting any better, that they certainly could have something like Crohn's or colitis or diverticuli, which is not going to be fixed by an antidiarrheal. Drugs affecting the eyes and ears, you got anti-glaucoma agents. We know that glaucoma is a medical condition where you have increased intraocular pressure. The pressure in the fluid in the eye becomes elevated, which causes a obstruction of the eye's internal blood vessels. Not only is there a loss of vision, but it's also painful. Beta blockers have been used to certainly treat glaucoma. Carbonic anhydrase inhibitors are also used to treat glaucoma, and prostaglandin analogs are also used to treat glaucoma, and there's certainly a list of those medications there. Mydriatic and cycloplegic agents. Mydriosis is to dilate the pupil. So a mydriatic drug is going to dilate the pupil and suppress the eye's reaction to light. Whenever you dilate the pupil, certainly when it's not bright outside, pupil dilation occurs naturally during a stressful situation, during fight and flight, in an effort to bring more light in so you can see clearer. But by taking these medications and dilating the pupil, it can be used to treat inflammation, they can be used to treat pain, they can be used to allow the eye to rest. you'll see, if you've ever been to an optometrist and have had your eyes dilated, you know how difficult that is then when you go out in bright light. Anti-infective, anti-inflammatory agents for the eye certainly are used to treat conditions like conjunctivitis, corneal inflammations, small scratches to the corneal surface, or small corneal abrasions. Topical anesthetic agents help reduce eye pain without getting into the bloodstream and causing systemic effects. They include tetracaine and proparacaine. And there are other ophthalmic preparations as well that people may use, over-the-counter artificial tears, over-the-counter get the red out, lubricants, that sort of stuff. Drugs affecting the ear. Certainly there are antibiotics that can be given in patients who have otitis media or ear infection. There are anti-inflammatory agents, there are analgesics, and there are products to help remove wax buildup, wax candles, the wax vacuum, and cerumen softeners that people can put into their ears that help soften the earwax in those people who have an overproduction of cerumen. Drugs affecting the endocrine system. The endocrine system, we know, is made up of endocrine glands that secrete hormones, and as a result of these hormone secretions, complex cascades occur. And we'll start first with drugs affecting the pituitary gland. The pituitary gland affects growth, intravascular volume maintenance, and the release of other hormones. And the pituitary gland has an anterior and a posterior pituitary gland, and they exert important hormones that affects the entire body. The anterior pituitary gland drugs are listed there: sandostatin, Actar, protropin, humatrope, and Garif. And posterior pituitary gland medications are listed there as well. The thyroid glands and the parathyroid glands, the parathyroid glands and the thyroid glands regulate the metabolic rate, affect normal growth development, and the release of calcium. The parathyroid controls calcium release from bones and from other parts of the body as well. Patients who have poor thyroid function, they're either hyperthyroidism or suffer from hypothyroidism, will take medications like Synthroid, Euthroid, Lugol's iodine. Those are thyroid medications that a patient can take if they have hypothyroidism. And then those with parathyroid disease can take drugs like Calderol, Calcimar, Mithrasin, and those drugs help with the release of calcium. Drugs affecting the adrenal cortex. The adrenal cortex is the cortex of the adrenal glands. The adrenal glands sit on top of the kidneys. The adrenal cortex secretes glucocorticoids, which include glucagon, and glucagon increases blood sugar. When glucagon is released by the adrenal cortex, it causes your liver to release its sugar stores into the bloodstream, and then through glycolysis, through a process, glycogen is converted into glucose. So a glucocorticoid would be glucagon. And if we have a patient who has a low blood glucose and we can't get an IV or an IO established to give them D50, then we can give them glucagon IM. And if they have sugar stores in their liver, we will raise their blood glucose, maybe to a point where they can wake up and drink something that contains sugar. Mineral corticoids include aldosterone, and mineral corticoids help regulate electrolyte and water balance. Aldosterone, when released by the adrenal cortex has a role in retaining or eliminating sodium, and water follows sodium. And then from the adrenal cortex as well comes the sex hormones that are steroidal. Testosterone actually is not released by the adrenal cortex, but certainly testosterone is released by the testes, created in the testes. Estrogen and progesterone are female sex hormones that are secreted by the ovaries. Drugs affecting the pancreas. Now the pancreas is important because two things. It releases insulin, and it does release pancreatic fluid, which is help used to digest amino acids and fats. So the pancreas is extremely important. The pancreas secretes insulin. Insulins come in a wide variety of forms. You can have rapid-acting insulins that work within 15 minutes. You can have short-acting insulins that work within 45 minutes, intermediate-acting, long-acting, combination of any. You can have insulins that work over a 24-hour period, so you give you a nice steady flow or control of insulin. Drugs affecting the musculoskeletal system. Uricosuric drugs are drugs that suppress the production of uric acid. When a person creates a lot of excess uric acid, then those crystals are formed in the blood, and those crystals are very, very painful. So colchicine is a drug that's used to suppress the immune response that precipitates the pain of gout. Non-steroidal anti-inflammatory drugs like indomethacin are used to treat gout as well. They inhibit the pathway of inflammation. Allopurinol is another drug that is used to treat gout. Allopurinol reduces the production of uric acid. So the products of uric acid can't be metabolized when you take the allopurinol, and so it decreases the products of uric acid metabolism, which often cause the crystals and the pain. Drugs affecting the reproductive system. Contraception is the prevention of pregnancy. So certainly there are drugs that can be taken, like birth control pills, Depo-Provera shots, that have effects in reducing the chance of pregnancy. And then there are emergency contraceptive pills. There's several on the market, Plan B, Next Choice, My Way, and they can be progestin only, or they can be a combination of progestin and anti-progestin pills. And these increase the amount of progesterone in the system, which makes it more difficult for fertilization to occur. And we have ovary stimulants and drugs used for infertility, and clomiphene citrate induces ovulation and increases the chance of fertilization. There are drugs out there that are used for labor and delivery, drugs to stop contractions as well as drugs to increase contractions. And some of the more common drugs to stop contractions include magnesium sulfate. So it's not uncommon that if you have a female patient who's less than 24 weeks in her pregnancy and she's in active labor, they'll put them on a mag drip, magnesium sulfate drip, maybe terbutaline as well. You notice some of those other medications, the nifedipine, which is a calcium channel blocker, which decreases the amount of calcium going into the cell, which is going to decrease the strength of contractions, that sort of stuff. The indomethacin, used to treat other problems, but also can be used for labor to stop contractions. We most commonly are going to see magnesium sulfate and terbutaline. Increased contractions is oxytocin. So you'll hear of people that that well, they're going to put me on a pitocin drip, or they're going to pit me because I'm not in labor like I should be. So there are drugs that they can give to increase contractions. Other drugs affecting the male and female reproductive system include testosterone. You can get testosterone over the counter, not over the counter, by prescription. You can get testosterone. And testosterone is important in the male. It's necessary for secondary sexual characteristics. When men age, obviously the need to fertilize becomes less, and testosterone is produced at much lesser rate, and men develop what's called low T syndrome, where their testosterone level is low, and by replacing that testosterone and increasing their testosterone levels by either an injection, a shot that's given once a week, or a paste or a gel that's placed on the body, they're able to regain some of their activity back, to increase their sexual stamina and desire and all that other stuff. There are also drugs out there to treat erectile dysfunction. There's a wide variety of reasons that men have ED, and so these don't work on every reason that a person has ED, but the more common reasons, like flow. If flow is an issue, then these phosphatidylserine inhibitors work in dilating the vessels to the penis and increasing blood flow, causing an erection. They include Viagra, Cialis, and Levitra. There's a daily Cialis, rather than taking them for when the moment's right. By taking a daily Cialis, then I guess you're already all the time. The issue with phosphatidylserine inhibitors is that they potentiate hypotension when given with nitrates. So if you've got a patient that you're about to give nitroglycerin to for chest discomfort, you need to make sure and ask them, have you had a drug for erectile dysfunction in the last 48 hours? Because if they had, I would be really cautious administering a phosphatidylserine inhibitor. Drugs affecting the immune system include immunosuppressants. And immunosuppressants target the immune system, and they inhibit the production of immune cells. And why would we want to suppress our immune system? Well, commonly after a transplant, a kidney transplant, a heart transplant, a pancreas transplant, your body has a tendency to want to make cells or reject the transplant. And by taking immunosuppressants, they can decrease the likelihood of that happening. But the problem with turning off the immune system is that now their defense mechanism is down. Their guard is down, and they certainly are opened up to other opportunistic infections. There are 5 different groups of immunosuppressants with multiple drugs in each group. So there's no way to list them all here, but they include glucocorticoids, cytostatics, antibodies, drugs acting on immunophilins, and then other drugs. Immunomodulating agents, they increase the immune system's efficiency, and they're going to include vaccines that we take to develop new antibodies and memory cells, so that should we be exposed to a particular virus or illness, that we have the antibodies to help fight it. Immunoglobulins can be given as well to increase immune system efficiency. Dermatologic drugs work on the skin. They're more slowly absorbed. They include things like hydrocortisone cream, is what you think of with skin itches, rashes, bites, those sort of things, but certainly there are a wide variety of medications that can be absorbed slowly through the skin. Birth control patches, nitroglycerin patches, hormonal therapy patches, pain control, they make fentanyl in a patch form, muscle relaxants in a patch form. So there's a wide variety of medications that can be applied on the skin, slowly absorbed, and have an effect. Drugs of abuse and misuse include stimulants and amphetamines, particularly methamphetamines. Methamphetamines release large quantities of the neurotransmitter dopamine, and these enhance mood, increase alertness, decrease appetite, but they also raise your temperature. They make you feel euphoric, like everything is great and everything is good, but in excess, the side effects include cardiac dysrhythmias, certainly death if the cardiac arrhythmia is significant enough, blood pressure's up, that sort of thing. Methamphetamine overdose, when somebody is on a methamphetamine, they stimulate the sympathetic nervous system. And so when somebody's on methamphetamine and they take too much, we'll see a sympathomimetic toxidrome. And that's what occurs when the sympathetic nervous system is stimulated. So everything's going to be up when a person's on a stimulant or an amphetamine. Their heart rate's going to be up, their blood pressure's going to be up, their temperature's going to be up, their respiratory rate's going to be up, everything's going to be up. Amphetamines include cocaine, ecstasy, bath salts, and people take them because they exhilarate you, because they just give you this up that you feel so great, like you can accomplish anything, and that sort of stuff. But amphetamines are extremely addictive, and in some patients can cause coronary artery vasospasm, which if significant enough can lead to a heart attack. And again, the side effects of these medications are overstimulation of the sympathetic nervous system. Everything is so high, blood pressure is really through the roof, that sort of thing. So you're at a greater risk of developing heart attack, stroke, and a lethal arrhythmia when taking these. Sedative hypnotics, they sedate you, they slow everything down, they induce sleep. Many are often controlled Schedule 4 controlled substances. They include morphine and all the morphine derivatives, heroin, benzodiazepines, and barbiturates. And when somebody overdoses on a sedative hypnotic, that's known as an opioid toxidrome, and it has a real classic presentation. With an opioid toxidrome, everything is down. Their central nervous system is depressed, their respiratory rate is down, their blood pressure is down, but their pupils are also pinpoint. Gamma hydroxybutyric, it's a rapidly acting synthetic CNS depressant, GHB for short. It causes euphoria, relaxation, but also particularly mixed with alcohol, it causes respiratory depression, nausea, vomiting, coma, and death. We saw GHB show up in bodybuilders particularly who were taking anabolic steroids. The anabolic steroids that they took, they would have roid rage. So in order to combat the roid rage, they would take GHB, which would calm them down and make them not so worked up. And we would see it in patients who were taking their GHB and didn't know that, boy, if I just have one beer, I can be completely unresponsive and in need of a ventilator. So we don't see as much of it anymore because it's illegal. You used to be able to buy GHB at GNC or any of the health food stores, but because of the deaths associated with its use when in combination with alcohol, it has gone off the market. Now another medication that is a rapidly acting CNS depressant is Rohypnol. Rohypnol is the date rape drug, often referred to as a roofie. Rohypnol is tasteless, odorless, calorieless, and certainly when combined with alcohol can make somebody forget everything that happened. So it's popular as a date rape drug because it can be marketed to that crowd that doesn't want an OWI, doesn't want the calories, is the fact that it is tasteless and odorless. It can be slipped in just about anything in liquid form, and you wouldn't even know it occurred. 1,4-butane-diol. 1,4-butane-diol is a precursor to GHB, or gamma hydroxybutrate. 1,4-butanediol is legal to purchase with a permit, and you see it out on the streets as 1,4, 1,4-B, or 1,B4-BDO, and it's legal at this point. You must have a permit to purchase it. It's the main ingredient in spandex and some of the synthetic covers over bumpers and those sort of things. But when taken and the liver metabolizes it, it converts to GHB. So you get that CNS depression when you take this 1,4-butanediol. Hallucinogens affect your perception of time, reality, and the environment. They can affect your cardiovascular system. Your pupils become dilated, your heart rate increases, you become incoherent, you sweat, you lose your appetite, you can't sleep, you get a dry mouth, and certainly in enough excess, alcohol or ethanol, grain alcohol, can be a hallucinogen. But we're thinking more on the lines of magic mushrooms or LSD. Environmental substances include herbicides and pesticides. Herbicides kill weeds, but they are toxic to humans as well. They can be absorbed through the skin, they can be inhaled, they can be ingested. They cause kidney and liver dysfunction as well as non-Hodgkin's lymphoma. Bepedril and chlorophenoxy are two herbicides that are out there. Rodenticides kill rodents. They interrupt the normal blood clotting functions, causing internal hemorrhage and death. And the rodenticides are often mixed with bait. An example would be decon, and the main ingredient in decon is warfarin or coumadin. These rats that consume the bait thin their blood out to the point where it causes internal hemorrhage and they die. Insecticides, you can have chlorinated hydrocarbons that when can get into the body through absorption through the skin or through inhalation of the gases or ingesting them as well. They cause tremors, convulsions, and the chlorinated hydrocarbons disrupt the sodium channel rapid firing in the neurons. Organophosphates are the insecticides that we're concerned most about. Just because of our location here in the Midwest, organophosphates can be absorbed through the skin, through the respiratory tract, can be ingested as well. And organophosphates inhibit acetylcholine esterase, so they inhibit the breakdown of acetylcholine. So acetylcholine builds up and up and up in the system when you're exposed to an organophosphate. And signs and symptoms that a person is then exposed to an organophosphate, they sludge them, they salivate, they lacrimate, they urinate, they defecate, they have gastrointestinal upset, they have emesis, their pupils become pinpoint. And most importantly, when dealing with patients who've been exposed to chemicals, is our need to use personal protective equipment. May require even respiratory protection, and if that's not something you've been trained in or have access to, then having the fire department with SCBAs do some decon prior to taking care of them would be appropriate. Decontamination, following decontamination, medications like atropine can be given, and 2-PAM chloride 2-PAM chloride works on organophosphates, but not carbamates. And those include Dursban, Lorsban, diazinon, malathion. Those are all examples of organophosphates. Now, the amount of atropine needed to reverse the effects of the sludging, that's how we know we're going in the right direction, is we're going to double our dose of atropine every time we give it until we get these patients to dry up. So you might start off with 1 milligram, your next dose would be 2 milligrams, your next dose would be 4, and then 8, and then 16, and then 32, and that's a lot of atropine. Most trucks are lucky to carry 6 milligrams, let alone 32. Carbamates inhibit acetylcholinesterase as well. Carbamates include chemicals like ortho-7, furidan. Those would be examples of carbamates. And carbamates don't respond to 2-PAM chloride, so they would respond to atropine, but not 2-PAM chloride. An example of a botanical carbamate would be nicotine. Alcohols are also something to consider as poisons. Ethanol, which is certainly what we find in beer, wine, and spirits. It's grain alcohol. With enough ethanol, with an ethanol poisoning, you certainly can get loss of airway, loss of airway reflexes, and are at great risk of aspiration. And the care for ethanol poisoning is just supportive. You just have to keep them awake, stay with them. If they vomited a lot, may consider an IV with some fluids to help replace the volume lost by all the vomiting that may be associated with alcohol poisoning. Isopropyl alcohol or rubbing alcohol is used as a disinfectant, but it can be absorbed through the skin. It can be ingested. The fumes can be inhaled, and toxicity symptoms include flushing of the skin, headache, dizziness, mental depression, nausea, vomiting, and anesthesia and coma. Isopropyl alcohol, when you were dealing with, let's say, alcoholics, when initially, their intent when they couldn't find a regular beer, wine, or spirits were to look for things in the home or around the home that contained some form of alcohol, thinking that they would, in fact, get intoxicated. But as you can see with isopropyl alcohol, there's no intoxication. Ethylene glycol, which is what antifreeze is, and de-icing solutions may contain ethylene glycol as well as antifreeze. Antifreeze is toxic if ingested. It leads to renal failure. Often at, I'm trying to hear it, or often with antifreeze, alcoholics would drink that because it had alcohol in it originally. Antifreeze had alcohol in it, and that's what kept it from freezing. They would siphon it through bread and drink it, but it's very toxic if ingested. It can cause renal failure. And the antidote for ethylene glycol overdose is ethyl alcohol, but it has to be in a controlled environment. Methanol you'll find in paint removers, glass cleaners, de-icing solutions. Antifreeze, shellac all contain methanol, and it's toxic if ingested or certainly if inhaled. You get headache, dizziness, drowsiness, and blindness. Heavy metals, they weigh 5 times more than what water does. They include lead, mercury, and arsenic, and iron as well. And iron toxicity certainly is an issue, something we're very aware of in lead and iron. Lead-based paints, that sort of stuff. Arsenic can be found. We used to find it in well water, in the country. You'd test your well water and it'd come back positive with arsenic, and which in large amounts can cause sickness as well. Iron ingestion. When you ingest iron in a high enough amount, it can cause an inflammation of the GI tract, vomiting, abdominal pain, and diarrhea, which can lead to shock, shortness of breath, metabolic acidosis, and death. The treatment for iron ingestion is chelating agents. Hazardous materials include irritants. Irritants interact with the mucous membranes of the respiratory system, mucous membranes in the eyes and mouth, and when these irritants combine with the moisture in those mucous membranes, they often form corrosives. The corrosives could be a strong acid or a strong base, and these corrosives then could lead to airway and respiratory tract inflammation, burns, damage. And irritants include chlorine gas, ammonia gas, phosphine gas, and ozone. Asphyxiants are gases that displace oxygen. They dilute the oxygen concentration in the air. Many of these asphyxiants have the same vapor density as air. They're odorless, colorless, tasteless, and so often you don't even realize that you're in them. And because they have the same vapor density as air, they're in the same place that air currents travel, and they dilute the oxygen concentration, so there's no or little oxygen in the air that you're breathing. We need at least oxygen concentration of 16% in atmospheric air. You get less than 16% oxygen in the air that you're breathing. That can be problematic. Asphyxiants include carbon monoxide, hydrogen cyanide, and methane. And of course we know carbon monoxide comes from incomplete combustion of any fossil fuel. Hydrogen cyanide comes from the burning of any synthetic or building material. And then methane comes from the fermentation and breaking down of grasses and those sort of things on the farm. Some other hazardous materials include nerve agents. Nerve agents are weapons of mass destruction. They affect the central nervous system and the respiratory system just like organophosphates do. So when you're exposed to a nerve agent, you're going to sludge them just like you do when you are exposed to a organophosphate. The weapons of mass destruction include sarin, soman, taman, VX, and the Russians have a Novichok agent that is undetectable and can permeate your personal protective equipment. Carcinogens are hazardous materials that cause cancer, and pretty much everything is a carcinogen, especially in the right amount. We find carcinogens in peanut butter. We find carcinogens in almost anything that we eat, bacon, all that sort of stuff. When we're talking about household and industrial chemicals, they can be absorbed through the mucous membranes, the eyes, and the skin. We see them in cleaning substances, and oftentimes, if drank to commit suicide, that can happen. So knowing poison control number 1-800-222-1222 is extremely important, because if I have a person who ingests a cleaning substance like we used to see back in the day, people would ingest lye, which was used to open up drains, because it is a very strong base. It's a corrosive, and it destroys and eats everything it comes in contact with. So people would ingest lye, and the object is not to make them throw that back up, not so much because it burned all the way going down, but because if they vomit, they increase their risk of aspirating that into their lungs, which could be fatal. Ignitable substances certainly are found around the house and in industry as well, and they're divided into combustible or flammable, and whether a product is flammable or combustible depends upon its flash point. The flash point is the temperature at which these substances emit flames that can ignite, and something is considered flammable when the flash point is less than 100, and something is considered combustible when the flash point is above 100. So as an example, if we look at ether, ether has a flash point of negative 49 degrees Fahrenheit. So even at 49 degrees 0, ether will emit fumes that will ignite, and that's why ether was very popular back in the days of carburetors to use in the dead of winter to start your car. It's found in starting fluid. Whereas if you look at turpentine, for example, turpentine has a flash point of 95 degrees Fahrenheit. So turpentine is flammable, but not until it reaches 95 degrees. That's why they didn't want your old paint-soaked rags and your paint thinner rags, which often had turpentine in them back in the day, sitting in your garage in a pile, because if it got real warm in there, then those fumes would, permeate the area and a spark would ignite them. Corrosive substances, they are substances that go to each extreme of the pH scale. They include very strong acids and very strong bases. Hydrochloric acid, nitric acid, sulfuric acid are examples of these. As far as the acids go, hydroxides, sodium hydroxide, potassium hydroxide, magnesium hydroxide are your strong bases as well. Reactive substances, they have an effect when mixed with another substance. So as an example, ammonia and chlorine, while both of these are very good at disinfecting and cleaning, we would never mix them together. Mixing ammonia and chlorine together gives you chloramine vapors, which are lethal and can cause death. Toxic substances harm the body. They cause burns, they cause pulmonary edema, they can cause cancers with long-term exposure, and again they include hydrofluoric acid. Hydrofluoric acid, when it comes in contact with the skin, can cause severe burns without changing the surface of the skin. Systemic effects associated with hydrofluoric acid include hyperkalemia, high potassium levels, low magnesium levels. The pain resulting from these burns can be severe. In treating somebody who's been exposed to hydrofluoric acid, you need proper personal protective equipment, and if you don't have it or not trained to do so, then we should avoid caring for the patient until somebody with proper PPE is present. Treatment is to put cold packs on the skin, IVO2 monitors, watch that ECG for a long QT syndrome or a development of a long QT interval caused by the electrolyte disturbances. Whenever you have a long QT interval, that increases your risk of sudden cardiac death. Calcium gluconate gel can be applied to the surface of the skin to help with the burn, and if it's in the eyes, eye irrigation is necessary. So in summary, wrapping up Chapter 12, indication is the appropriate drug is used. Indication is why a drug is needed. We give nitroglycerin is indicated for cardiac-related chest discomfort. Contraindication is when a drug should not be used. Nitroglycerin is contraindicated in patients whose blood pressures are less than 90. Poison control centers can be accessed by phone for information on overdose poisonings. Again, 1-800-222-1222. It's a number that's very important, should be in all your phones. No matter where you call that in the United States, you're going to get a poison control center. Gastric lavage is cleansing of the stomach through pumping and irrigating the stomach with water. Activated charcoal binds with medications. It cannot be absorbed into the systemic circulation and may be given, but often not because of the length of time that these drugs have been in the body by the time they reach medical care. Acetaminophen is very toxic. It does affect the livers. Acetaminophen and analgesics are used to also treat fever in addition to pain. Salicylates, in addition to treating fever and pain, certainly are used as antiplatelets, as an example of aspirin. NSAIDs are used for fever and for analgesia. Morphine, remember, it's an opioid, and it does relieve pain, but it does drop the blood pressure. Fentanyl is an opioid as well, which is 100 times more powerful than morphine, and it doesn't have the profound effect on blood pressure that morphine does. Opioid combinations are certainly medications that use opioid and something else, and these are the medications that have become very difficult to get from your physician because of their ability to be, you can become addicted to them. They include hydrocodone, oxycodone, Darvon, Darvocet, all those that we talked about. Aspirin and acetaminophen are often combined with a narcotic. Tylenol number 3, Tylox, those sort of things. They help relieve pain without giving you as much of the narcotic. Partial opioid agonists provide some effect and block the effect of the full agonist when given together. Opioid antagonists block the effects of agonists, and the opioid antagonist is Narcan. That's going to block the effects of the opioid. Anesthetics occur with deep sedation procedures, are used for deep sedation procedures, including surgery, but we use etomidate, which is considered an anesthetic, ketamine, which is considered an anesthetic when we do rapid sequence intubation. Conscious sedation is something that we will be part of in the hospital as well as in patients that we're caring for. Conscious sedation is something that we might use prior to synchronized cardioversion. Benzodiazepines are medications that are used to treat anxiety. There are also medications used to sedate patients, and there are also medications used to treat seizures. Romazicon is the antidote for benzodiazepines. Anticonvulsants, long-term anticonvulsants, are used to prevent and treat seizures. Antidepressants treat depression and bipolar disorder. Most antidepressants can cause cardiac dysrhythmias. However, the newer generation antidepressants, the SSRIs and the SSNRIs, are less cardiotoxic. CNS stimulants include anorexiants and amphetamines. Antipsychotics are used to treat schizophrenia as well as a variety of psychotic disorders. There are medications out there used to treat Parkinson's disease, Alzheimer's disease, and they alter acetylcholine and dopamine levels in the brain in doing so. Cholinergic drugs are rarely used therapeutically. We didn't mention physostigmine, but that is a cholinergic drug. If we had an anticholinergic overdose or an anticholinergic toxidrome, if somebody did overdose on their anticholinergic, then the treatment for that is physostigmine. And that's something that we don't do in the field, but certainly something that could be ordered in the hospital. Cholinergic drugs, such as those, the cholinergic drug in advanced cardiac life support, we don't use cholinergic drug. We use an anticholinergic. In advanced cardiac life support, atropine is the anticholinergic drug that we use. Sympathomimetics and catecholamines in ACLS, we use sympathomimetics, we use epinephrine, we use norepinephrine, we use dopamine. These are all synthetic made by man, by us, and also are hormones that are produced in the body. They're class 1 antiarrhythmics affect sodium channel work on slow conduction. Class 2 antiarrhythmics include beta blockers, which work on the beta receptors. They slow your heart rate, they slow conduction velocity, and they limit the strength of contraction. Anti-3 antiarrhythmics block potassium, and includes amiodarone. Class 4 antiarrhythmics block calcium channels, and they're used to lower blood pressure. And adenosine is used to slow fast heart rates that are originating above the ventricles. DIG is used to treat dysrhythmias. They block the ion pumps, and DIG is the primary drug used to treat atrial fibrillation. Diuretics are used to control pulmonary edema and blood pressure. Not so much pulmonary edema anymore. We shy away from the use of Lasix in the treatment of pulmonary edema, but Lasix is being used in chronic situations of hypertension to help lower blood pressure. Anticoagulants are used to inhibit clot formation. They include things like our thrombolytics or fibrinolytics that are used to break up clots once they form. Anti-hemophilic agents are used to treat bleeding after trauma in patients who lack particular clotting factors. Bronchodilators are used to help stop bronchospasm as well as to dilate the bronchioles so that you can improve your work of breathing. Mucinetic drugs are used to loosen up mucus so that you can cough it up. Antihistamines are used to block the release of histamine, which helps reduce tissue edema. And acids treat the overproduction of acid, which cause heartburns. Antiemetics are used to treat protracted vomiting and nausea. H2 receptor antagonists are used to block histamine in the GI tract. Proton pump inhibitors are not mentioned here, but they're the next generation of medications like Prilosec and Nexium that also help reduce acid production in the GI tract. Ophthalmic agents are used for diagnosis and treatment of eye diseases. Otic preparations are used for analgesia and treatment of ear diseases. Hormones can be used to treat various endocrine problems, and antibiotics are used to treat bacterial infections, and there are many different types of antibiotics that are out there available. Antivirals are used to treat viral infections, to include HIV and influenza. Antifungals are used to treat fungal infections that can affect the skin or the entire systemic circulation. Gout is an extremely painful type of arthritis as a result of an increase of uric acid, and so there are uricosuric drugs, including NSAIDs, that are used to treat the production of uric acid as well as the relief of pain associated with gout. Vitamins and minerals are necessary for normal body function. We often don't get enough, so we may have to take over-the-counter vitamins and mineral supplements. Crystalloids include your IV fluids that you're going to see in the field: normal saline, lactated ringers, D5W, D5 half normal, D5 normal saline, etc. Immunizations are designed to prevent infections, and that's the best way to, not become infected with viruses and diseases, is to keep up on your immunizations. Immunoglobulins are used to treat infections as well. They help when administered. They perform like antibodies. Antidotes are used to treat poisons and toxins, and the Poison Control Center would let us know what sort of antidotes that are out there for specific medication overdoses. Drugs of abuse include stimulants, benzodiazepines, narcotics, hallucinogens, sedative narcotics. Ethanol certainly can be a drug of abuse. And all these drugs of abuse have different signs and symptoms when taken in excess. Some have antidotes, some don't, and again, Poison Control Center is your best bet on how to treat those. Herbicides, rodenticides, insecticides can be highly toxic to humans as well as to bugs and rodents if in the right amount. Isopropyl alcohol, ethylene glycol, and methanol are all in the alcohol family, and if drank, certainly can be toxic. And we know there's a variety of hazardous materials that are out there that we may respond to that may be toxic to us, and being able to recognize those and protect ourselves with proper PPE is an important part of training, and we'll receive that later in the class when we have hazmat operations level training. Alright, so that ends Chapter 12. With that, I'm going to sign off, and I'll talk to you soon.